right, I think we're live. Hello, everyone. Good afternoon, good evening, good morning, wherever you're watching us from this day. Thank you so much for joining us. We're super excited with this interview today. It's part of our endometriosis awareness conversation that we're having this month. As you all know, this month of March is the endometriosis awareness month, and it's also women International Women's Month. So I think it's all inclusive in all that we're doing, and we're so glad to have our guest with us today. She's a women's health expert, an hormone specialist, an author, a speaker, and advocate as well. So very soon I'm going to be introducing her, but I just want to say thank you so much for joining us. We truly appreciate you. And to our audience, I want to say thank you so much for joining us today. If you have any question along the line while we're having this discussion, just drop it in the comment section, and we'll be able to pick it from there. Thank you so much. Alrighty, so before we dive in, let me quickly read an introduction about our guest today. Her name is Dr. Yewande Banire. She's a clinician specialized in women's hormonal health, midlife care, and integrative wellness. She's the founder of Serene Infusion and Wellness Lounge in the US and Serena Wellness in Nigeria, where she develops and implements evidence-based programs for women navigating perimenopause, menopause, PCOS, fibroid, and metabolic health. Yes, she is all well round. She's also an author of Living with Fibroid and How to Thrive with PCOS. Her work integrates advanced clinical practice with cultural competence, patient-centered care. Thank you so much for joining us today. We truly appreciate you. Before we dive into the questions, I just want to give you a few minutes to just say something to our audience.
Okay. Well, thank you so much for having me. And thank you for putting this together. Endometriosis is, we have a research that shows that 1 in 10 women will be diagnosed with endometriosis. But we know that the number might even be more because the diagnosis is not easy. To get a true endometriosis diagnosis is not as straightforward as the other any form of disease, where we can use either blood markers or CT or MRI. So because of that, there's a delay in diagnosis. And I'm glad that we're having this conversation because the more people know, the more they understand and the more they can advocate for themselves. Because a lot of young, old women, young girls and old women or adult women actually are suffering from different conditions, especially since we're specifically targeting the Nigerian audience or the African audience, because we have so many autoimmune diseases too that, that we don't even treat well in Nigeria. So thank you for putting together this session. And I hope everybody walks away with knowing one thing. If you don't remember anything today, remember that pain during your menstrual period is not normal. Pain that to not go to school, pain that causes you to vomit, to cry, to start having diarrhea. Like I said, pain that alters your life during your menstrual cycle or outside your menstrual cycle is not normal. So it needs to be evaluated.
Thank you so much. Sorry why you were you were talking. I was busy trying to see, making sure that we are live on YouTube. We're live on YouTube. We're live on Facebook right now. For as many that are on Instagram, I think we are having some technical issues. So please join us on Facebook or YouTube. All right, so let's dive into our questions today, since we have the expert in the building. All right. So when someone hears about endometriosis, that can be a big word. As a matter of fact, when I was first diagnosed with endometriosis. Sometimes I will not be able to pronounce it. Sometimes I will even forget. So it can really, really be a big word hearing it for the first time. But how can you simply break it down to someone, a layman person, that really is going through pain, but they really don't understand what endometriosis is all about?
Absolutely. And I'm going to do my best today to use the simplest terms possible because, like I said, I know that a lot of our audience today are Nigerians and
Mhm.
really understand what we're talking about today. So, in simple terms, when we say endometriosis, endometriosis is a chronic inflammatory disease, which means that your body is always inflamed. Your body is always trying to put off fire. Okay. Inflammation is when the alarm in your body is always going off. So, your body is always trying to stop it. So, it's a chronic inflammatory disease. And what this simply means is that when you look at your womb, okay, the uterus, there's a lining in the womb that sheds during the menstrual cycle. That lining is called the endometrial lining. Okay. So that lining should really only be in the uterus because during your menstrual cycle, if there's no pregnancy, it will shed. So it has a place to go. But that lining starts to grow in different places. Okay. So endometriosis just means that the lining, the endometrial line like lining that should be only in the uterus is growing in different places. And we can
Mm.
on the ovaries, we can find it in the pelvic, we can find it in the lungs, in your colon, we can find it in the diaphragm, we can find it in any organ. Before, we used to say that endometriosis was a reproductive disease, but not anymore. Now we know that it's a condition that can affect you from head to toe. So when you think about endometriosis, just remember that the lining that should be growing inside your uterus is growing outside, is growing somewhere else. Now, why does this cause pain? Because the lining that grows inside of the uterus sheds during your menstruation. It sheds, it will fall off, it will bleed and get out. This lining, when it's on different other organs, it doesn't shed. There's nowhere else to go. Okay, so that is the problem. So what happens? It continues to grow. It continues to grow, and as time goes on, it sticks all the other organs together. Okay, it starts to together because remember something is growing there. So what happens? There's no space. There should be little spaces between the organs. It doesn't happen because it's growing outside. It starts to distort. It starts to change your anatomy. Okay, it starts to change the way your uterus should look. It starts to change the way your liver should look because it's sticking
Wow.
organs together. Okay,
Mm.
that's what causes pain because there's nowhere. There's no shedding. There's nowhere for it to go. In simple terms, that's what endometriosis is.
All right. Thank you so, so, so much. That's really, really, very simple for anyone to really understand. Now, many women are growing up with pain. Women have grown up with pain in the past. We have young teenage girls now that are growing up with pain, but, because of our culture, our African culture, we've been conditioned to believe that this pain is normal and is part of what we, as a young girl or as a woman, we should endure and deal with. At what point should a woman or a young girl that realizes that this pain is something deeper should investigate and speak up?
When you start to have pain that is beginning to interfere with your life, when we talk about menstrual cycle, pain during menstrual cycle should cause some discomfort. It shouldn't be severe pain that would completely knock you off. It should
Mhm,
be pain, your pelvic pain, that would cause you to start having constipation, that will
mhm,
start having diarrhea, irritable bowel syndrome, that will
mhm,
cause start having chronic bloating, that will cause you to start vomiting, to start crying, to not be able to do anything at all. That kind of pain is not normal. And I'm saying this to parents as well. When your daughters complain about pain, don't think they're exaggerating.
mhm,
Endometriosis is a severe, severe condition. It hurts. Okay. If it's not endometriosis, it could also be fibroids. So don't ignore them and think that they're just exaggerating. Oh, no, it's normal. Pain is not normal. It's not. So when you have a daughter, or when you as an adult, or when you're a teenager that can advocate for yourself, when this pain is regular every month, like you just have these few days that you're anxious about your period already because you already know your life is almost going to stop for those few days, we need to evaluate deeply. It is not normal. And I know culture makes it seem like, oh, pain is part of womanhood. It's not. Okay, it's a myth that we need to stop. Pain is never part of womanhood. We can have mild discomfort that would respond to little Tylenol or ibuprofen, but it shouldn't be so severe where nothing can touch that pain.
All right. Thank you. Thank you. Thank you so much. To our audience, if there's anything, and I know that we at LifeBloom, we've said this over and over and over again, and you're hearing it from the expert's mouth right now. If there's anything you need to hold on to, pain is not normal. So don't endure pain. Don't feel that, oh, it's part of what I need to be as a woman or what makes you to be. No, that is totally wrong. That is part of the narrative that we're trying to change. Pain is not normal. So please hold that, and just don't forget that. If you forget anything on this live today, don't forget that. All right. So help us understand, how exactly does endometriosis then affect our hormones?
Oh, it completely shifts it because when we think about pain, when your body is constantly in a state of inflammation,
Mm-hmm,
is your body's alarm constantly going off. That
mm-hmm,
puts your body in a survival mode. Okay. So your body is not relaxing, your body is not thriving, your body is constantly surviving. When your body is always surviving, it takes resources away from a lot of other things. And number one is reproduction. When your body's in that survival mode, all it wants to do is keep your heart healthy, keep the major organs functioning, because it needs to fight or flight. It needs to respond to an attack. Whenever you have chronic inflammation and you have eye stress, your body sees it as an attack. So it has to get itself ready. It pumps cortisol, it pumps adrenaline so that we can respond, because your body's number one priority is to keep you alive. Okay.
yeah.
So when we have endometriosis or we have a chronic inflammatory condition, it elevates your cortisol all the time. Cortisol should never be elevated all the time. We need cortisol to help us with our day-to-day life, but it should never stay elevated all the time, because when it does, it affects your hormones, it affects your thyroid, it affects your metabolism, it increases fat. So it causes hormonal imbalance, right? It affects how your body clears out estrogen. And as Black women, we already have a tendency to have hormonal imbalance anyway. Have a tendency to have high estrogen and low progesterone. Now add endometriosis to it, and it takes the cake. Okay, so it can cause hormonal imbalance. It can cause intense chronic pain. It can cause the way our liver detoxes estrogen, because all the organs, uh, endometriosis has a possibility of reshaping the anatomy. So the organs
Mm, yes.
when it distorts the shape, right? So this is why it's a full body inflammation. It's a full body condition, because it can be anywhere and it would distort and affect all the organs.
Hmm. Hmm. True, true, true. It's really true. And you know that a lot of time when you tell people that this condition is really, really serious and really bad, it's a full body condition, because it doesn't matter what part of your body you are dealing with endometriosis. It
Yeah.
affects, like, it just affects everything all the way. I'm like, but people don't get it. People just say, oh, she is just that pain,
Uh,
and
uh,
you just get dismissed and dismissed.
yeah,
How how do you think that we can navigate that space of people not believing, people trying to dismiss, even medical practitioners sometimes dismiss our pain?
absolutely. And this was a challenge that we have in women's health. I'm not going to lie. It's not just even with endometriosis, because we have so many conditions that are tied to women's health that are painful, right? And in different ways. So I think we just need to continue with this awareness, and we need to empower our patients or people that are suffering from endometriosis to not give up on themselves, to continue to, unfortunately, it becomes expensive, right?
Yeah.
To move from one doctor to another, it becomes expensive. And but don't let anybody tell you that your pain is not real, because it is. Your pain is real, and it affects you mentally too, right? Because if you're always in pain, how are you going to be happy? How can you live a truly thriving life, right? So don't let anybody gaslight you into thinking what you're saying is not real. Continue to find providers like me who are women's health specialists who have taken extra training to make sure that we understand how to treat women correctly. At least the thing I tell people is, how can you, now we have instances where some people exaggerate, but it's not our job as medical providers to say someone is exaggerating. What we can do is to investigate. We need to investigate and then make sure that what they're saying is not what's going on. Right. I remember that there was a story, and I can't verify the story, but it was a story that was shared by another doctor on TikTok, and she said one doctor said that because they said what is one of the most awful medical negligence you've ever witnessed, and it said there was a woman who comes in all the time, complaining about severe pain all the time for years, and the doctor kept saying, oh this, oh that. And this is, they kept dismissing her. They thought she was hypochondriac, which means, all the people that fake diseases. And eventually she died. It said when they opened her up, she
Mm.
had endometriosis everywhere. She had endometriosis everywhere. All of her organs were stuck. It said it was so terrible. And this woman had been crying for years that she was in pain, and they never took her seriously until she died. Until she died. And I know that we have so many other factors that plays into endometriosis because we don't have blood markers, right, that we can use, like a blood test, or go draw a blood test, and then we can, we don't have a specific one. The procedure for diagnosing endometriosis is also extensive by itself. So that's one of the issues. But as a medical provider, our job is always to investigate. So don't let anybody shut you up. Don't let anybody make it seem like you're making things up. You know your body, and if you're in pain, you deserve to find relief.
Thank you so, so much. Thank you. And thank you for giving us that example. Because sometimes when I jump online and, I tell people how bad this condition is, they don't, it's like people are not getting it.
Oh,
And I don't know how else, you know, to break it down. Maybe because I'm not in the medical field, but we've had medical experts, you know, on here like you are, helping us to break things down and all that. This is a very serious condition. Somebody died.
yeah,
When I was in secondary school, I witnessed a classmate of mine fainted.
yeah. See,
Mine didn't get to that point, but mine too was pretty severe. Every month I will be rolling on it. Actually, every month that was how I started having anxiety,
yeah, yeah.
because by the time it's getting to that time of the month,
Really.
my heart will start beeping very fast. How is you know, and I'm worried. I'm concerned that for a whole week I'm not going to be able to go out. I'm shut in. I can't. It's just a lot. And I'm
Absolutely.
glad that you also talked about how it affects our mental health. For me, it was anxiety. I've seen people that have been depressed.
Of course. Because it's a whole body condition, chronic pain. Imagine living in pain all the time. Chronic pain. Imagine you if the one of the most painful procedures or painful process that women go through is delivery, right? Is a vaginal delivery. That is one of the most painful procedures that we go through. But we go through that knowing that it's only temporary, right? We know that, okay, it might take a couple of hours, it might even take a couple of days, but we know that relief is coming. So imagine living with chronic pain without relief in sight, right? Chronic pain, because at some point it starts to affect your mental health, it starts to affect your relationship, it starts to affect your sexual health, it starts to affect your career, your education. A lot of women experience depression, they experience anxiety, they isolate themselves. They have this medical trauma from this condition. This is a serious life-threatening condition because, like I said, it impacts other organs and it causes such high inflammation. Like pain is the fifth vital sign. Who wants to live in pain all the time? What
I
quality
know.
do we expect that person to have when they are in pain all the time? Right? So
Mhm.
we need to continue to talk about it. We need to continue to, create this awareness. And I think the other thing that a lot of people don't get is because they don't see physical symptoms, right? So
Yeah.
it's not like your arm. They don't see physical symptoms, so they think, oh, it can't be that bad. But if
Mhm.
right? Because when some people have, different types of cancer, we don't necessarily see physical symptoms, right? It depends on the type of cancer. But are we going to take away their pain?
No.
But because a lot of people with endometriosis still look normal, they look healthy, people think, oh, well, there's nothing wrong with you. No, it doesn't mean that there's nothing wrong with them. So we need to stop minimizing people's experience and people's pain. But we can continue to do that by, what you're doing. This is a great job. We'll continue to create awareness and continue to educate the public about what this is and, how it truly affects women.
Thank you, thank you, thank you so much. Okay, so we've talked about that, and we both know that as it is right now, there's no cure for endometriosis, but it can well be managed. If you know on time, if it's diagnosed on time, it can, there are management plans for it. But beyond those medications, beyond surgery, which I had a lot of medications, I went through series of surgeries and all that. And a lot of people that follow me have heard about my story of how I, went in for an 11-hour surgery and all that. Beyond that, what are the lifestyle changes that can help women manage endometriosis symptoms very well?
So for a lot of my patients, one of the non-surgical procedures that methods that I use, um,
Okay. Sorry about that. I think maybe maybe a computer died or something. I'm sure she will reconnect back. Please stay hanging with us. She would rejoin. Oh, okay, she's back. Hello, just hang in there with us, people. I'm sure she would join us. I think she's trying to reconnect. She's trying to join back. It's dropping, but she's trying to rejoin. Okay, she's back. All
okay,
right. Okay.
yeah, my alarm came up and I turned it off, and I don't know if I eat something else, but I could still see you and hear you. But
Oh,
I,
really?
yeah, sorry
Wow. All righty.
about that. Hmm.
No problem. We were talking about the management plan that are how the beyond medication and surgery.
Yeah. So beyond medication and surgery is lifestyle. Because endometriosis is a chronic inflammatory condition, we have to make sure that we're eating anti-inflammatory foods. So we need to minimize any food that contains a lot of additives. We need to probably minimize using, a lot of Maggi or sodium or all these other cooking seasonings that might have a lot of additives. We need to make sure that we're working out a lot, because we need to make sure we're detoxing our system because endometriosis. We also need to make sure that we're managing our stress better. But how can you sometimes manage your stress if you're always in chronic pain? Which is where pain medications come into play, right? I don't think for my endometriosis patients, I don't start with lifestyle, because lifestyle cannot help them. Okay. This is not a condition
Mm,
that alone can take, no, because the pain has to be managed. The
yes.
hormones or the hormone imbalance has to be managed. So trying to start with lifestyle is almost like disregarding everything else that's going on with them. Because how can you think about lifestyle? How can you work out? How can you, if you're in pain, right? So for me, one of the non, I use a lot of medications a lot, because this population need the support, need the hormone therapy support. If
Okay.
conceive, sometimes we will use some birth control. We have sometimes ibuprofen is not enough, so we use a little stronger pain medication if we need it. Now, in addition to that, then we can have the lifestyle changes, manage your stress better, try to get enough sleep, because when you sleep, your body brings down, your body rests, right? Make sure that you're detoxing your pathway. Like I said, eat foods that will help you detox your pathway, like, carrots, hugo. Make sure your food is rich in vegetables. People with endometriosis or any other hormonal conditions, you don't have the luxury to just be eating carbohydrates all the time. No, you have to
Hmm. For
diet.
some of us that likes to eat
A lot
rice
of us love rice. Okay, a lot of us love rice, fried rice.
or pasta.
With you don't have the luxury. You have to modify it. You can only eat so much at a time. You have to
Mm,
has to be more protein and more vegetables for you, because of the condition. So these are things that we can do that can help minimize the flare, that can help control it. We already know it's a lifelong disease, so we just have to manage it.
manage it.
The things that we can do that can at least, lives a little better.
Mm. Thank you, thank you, thank you. And it's very interesting that you mentioned that because dealing with endometriosis, I did not have that awareness. I didn't have that awareness that I don't have the luxury to eat carbohydrate like every other person. That I have to eat more protein, more vegetable. I didn't have that awareness, or even though they were bombarding me with a lot of medication, pain medication, and all that. And then they were telling me to exercise, and take a walk and all that. But nobody was really specifying about that food,
Yeah.
which is a big thing. It's really a big thing. So if you are online today and you're experiencing pain, I hope you catch that you don't have that luxury to eat carbohydrate like every other person would eat.
No, no, you don't. We have to modify it. Food is a huge part of our culture. So I don't always tell people to not eat their food, but I ask people to modify it. Okay. So if you're always eating rice every day, you got to cut it off and, to change it to maybe 3 times a week, right? So that way you still feel that craving. And, or if you're going to eat every day, it has to be very little quantity, right? Your carbohydrates has to be no more than 20 to 30 grams a day, very little quantity, add protein and add everything else. Make it as fancy as you want, but you don't have that luxury, because what happens is that, high carbohydrate diet increases your insulin, increases your blood sugar. Plus, increase in blood sugar causes even more inflammation. You're already you're already inflamed, because of endometriosis. So any diet that causes even more inflammation is going to cause you to be in this amount of flare all the time.
Hmm, hmm, hmm. So what I get it, we've spoken about eating well, eating the right set of food, and all that. But for someone that is really in the thick of endometriosis right now,
Mhm.
what are the practical things that they need to be doing? Apart from food, apart from medication, for somebody that cannot afford surgery, what are other things out there that I know that growing up and before I got into doing surgery and other things, for me it was everywhere in my house, like from head to toe, there's always hot water bottle. So when I'm having pain, I put hot water bottle on my tummy, or I go take a shower. So when I'm on my period, I can take hot shower like multiple times a day, because it just has a way of just giving me some relief. And then I take pain medication and then I go to sleep. What are other ways? Are other things out there that people
So
can?
realistically, we don't have too many options in Nigeria.
Mm, mm,
Realistically, we don't. Because for my patients here in the United States, the other ways is I can refer them to pelvic floor physical therapy. Okay. Because pelvic floor PT, they do phenomenal work, with people with endometriosis. Uh,
mm,
refer them to life therapists,
excuse
right?
me.
And help them with their mental health and how to cope with this pain. But in Nigeria, we don't have too many resources, unfortunately. The things that people can do by themselves, for themselves, it's not for someone who cannot afford to have a surgical procedure. We just mean that person has to be so top notch on their diet. Okay. And if you can't afford to, get it, protein, because we already know protein is expensive. We already know meat costs. We already know fish can be expensive. So we have to find different sources of protein. It might not give you a huge amount of protein, right? But it might help. One thing that also that can help is intermittent fasting. Intermittent fasting is also an intervention or a tool that can help reduce inflammation, right? Because it helps bring down inflammation, it helps to control that blood sugar and things like that. Make sure that you're not overweight, okay? If you're overweight, that's also going to add to your flare up. So for someone who is actively suffering through endometriosis, unfortunately, you have to find resources to see a doctor so that way they can help keep things under control, and then you can start to manage from there. This is a condition of pain. When conditions of pain, it's almost like you asking me that if someone has cancer or if someone has diabetes, like no, like there's some conditions that lifestyle and lifestyle interventions alone is not enough.
Not enough.
One of those. Endometriosis is one of those. It's not if you're actively in pain, if you're vomiting during your period, if you're fainting, if your life is so debilitating during your menstrual cycle, there's really little that you can do by yourself. You need to go see a doctor. You need to be evaluated. So endometriosis is one of those conditions that there's not much you can do in lifestyle, especially in Nigeria, that you just have to find someone who would help you with whatever you respond to. Because remember, different people even respond to different procedures, different interventions, differently. So we don't even know, because the gold standard for endometriosis is still laparoscopy surgery, right? Not too many people can afford that, and that also has its own complications, right?
It
Because if
does.
do that and we diagnose you, then what, right? Then we have to do the laparoscopy excision because that is the gold standard. That is the most effective way of getting rid of it. But we also know that even with the excision, number one, they might not get all of the tissues because it is
Sure.
expensive. Number two, it can regrow,
Oh,
right?
yeah.
So when we're thinking about a place like Nigeria with the broken health infrastructure, I don't recommend that because the complications that comes after it, then what? Who's going to manage it, right? How are you going to be afford to pay that? So for us, is really I advocate more on medication management so that we can get things under control initially, and then you can have diet. But apart from diet and sleep better and exercise, mild exercises, there's really not much else we can do in this particular condition because it's just intense inflammation.
Hmm. All righty. Thank you so much. We're gonna keep, you know, talking about this because we want it to
Mhm.
sink in. But as well as when we hear anything new about research going on, because we know that constantly research is going on constantly.
Thankfully, there's a lot of research going on right now. Uh,
Hmm.
so hopefully, in the next few years,
Yeah.
hopefully a much more robust way of managing it better. Hopefully, we'll have another method of actually being able to diagnose endometriosis. I know that the American College of Obstetrics and Gynecology just released a statement in their management
Okay.
of endometriosis, which is now they're saying that clinicians can use clinical symptoms, clinical presentations beyond, because just like in Nigeria, not everybody has insurance, and we know that
Hmm.
those are very expensive. Uh,
Yeah.
they've released the guidelines that says that we can, based off clinical symptoms, that we can actually, add a differential diagnosis of endometriosis.
Oh,
So
wow.
they're
That's way in the right.
absolutely. So they're constantly working on it. They're constantly, there's so much research. So hopefully in the next few years, in addition to the advocacy and the awareness, hopefully we'll get to a place where we have a much more robust way of actually managing and treating endometriosis.
Okay. All righty. Thank you so much. I want us to dive into hormone issues a little bit
Yeah.
and why women need to really take care of this aspect of their life. I recently just started taking it serious myself because I see that it's beginning to affect different areas of my life, and all that. I'm dealing with how to um, um, get on weight loss, how to, reduce my weight, and, it's just, it's a lot.
Yeah.
How do we balance these hormones?
Okay. So when we talk about hormonal imbalance, I need to group it into different age groups. Okay.
Okay.
When you're young, from the time you start to see your period till 13, 14, that age, to about 25. Your hormones are doing what they need to do because you're young, your organs are working well, except you have underlying conditions like endometriosis or PCOS, right?
Mm.
Or if you're diabetic or you have high blood pressure, then this will automatically affect your hormones too. So beyond any underlying conditions, all these hormones are working well. When we start to talk about hormonal imbalance in midlife, so when you're 25 to 35, things start to shift a little bit. And some of the factors that affect the shift at that age, 25 to 35, is really stress. Okay. Now you're working, right? Because you're done from college, you're done with college. Now you have a job, it's stressful. Living in Nigeria alone is stressful on its own. Okay. So that alone puts you
Yeah, it is.
so that alone puts you in this fight or flight mode because you always have to be aware. You always have to be mentally alert because someone can come for it. Living in Nigeria on its own is a risk factor. And I'm not gonna lie, I'm being so serious. So now you have to factor in the Lagos traffic, factor in food, factor in all of the chaos, gas, all of that. So
Pollution.
that age range is really because of stress. Now they have relationship issues because now we have the cultural norms that says, okay, now you're done with college. Okay, where's your husband? Or, now you have that additional pressure, and you're still trying to figure yourself out.
Yeah.
That age range, when you start to have irregular period, when you start to have more painful PMS, when you start to have mood swings, I would say in that age period, beyond any other underlying condition, is usually stress. So that age, you need to manage your stress better. And I know we say that and you think that, oh, that's all they say, because there's science behind high stress uh, situation. There's science behind being stressed all the time. There's science behind chronic stress. It directly breaks down your body because it increases cortisol, it increases adrenaline. So there's science behind it. We're not just saying manage your stress better just because. No, we're saying it because there's science behind it. Now, when we move into that 35 to and above, this sometimes is natural, okay? Or maybe I would say from 38 and above, okay? When we start to experience hormonal imbalance from 38 upward while you're still seeing your period, that's what we call perimenopause. And this is natural. This is your body's natural transition because perimenopause means transition to menopause. And as Black women, we experience perimenopause differently. We have extensive research that shows that our symptoms are much more intense, they last longer, and they are much more severe. Okay. So when you are 38 and older, and you start to experience that you're forgetting things all the time, you start to have all this joint pain. You're tired all the time. No matter how much you sleep, you wake up tired. You're gaining weight, even if you haven't changed your diet. Your food remains the same. You're working out, or you have a physically intensive job, and nothing has changed, but you're putting on this way. Your mood, 1 minute you're happy, the next you're sad. You don't even know why. When you start, you're irritable, you're angry all the time. Now your husband is chewing beside you. You want to slap his face because it's irritating you. When you start to experience these changes, these are the hormonal imbalance changes that are usually normal. It's not a disease, it's normal. However, we have resources that can help you manage it because we don't have to live through it. For some people, it affects your sleep. You're not sleeping well. Some people, you start to have painful intercourse. So now you're running from sex because it hurts, right? You start to experience vaginal dryness. And when you start to have all these deficiencies in these hormones, it affects you from head to toe because your brain thrives off estrogen. Your brain thrives off progesterone. Your vagina thrives off estrogen. Your uterus, your breast, your skin, right? They live off of these hormones. They are not just reproductive hormones to just help you menstruate. No, they help to menstruate, they help you to get pregnant, but they also do a lot more beyond. So what we're saying when we get into this transition is that when we get to this point, when these hormones are so imbalanced, we can replace them so that you can continue to thrive at any age. And no debate is, oh, it's just part of aging. Nothing is part of aging. Okay. We can
Mm.
gracefully. We can thrive at any age. But when we're noticing these changes that happens, it can vary per person. Okay. So, and that's also the challenging thing about perimenopause is that for you, it can be itchy skin, it can be itchy hairs. For you, somebody else, it can be their hair falling out. For some people, it can be their skin breaking down. For some people, it can be mood. So the symptoms are so different depending on your body, right? However, you don't have to suffer. This is when hormone replacement therapy comes into place. This is when we start to replace some of these hormones. And I know some people will say, well, if it's natural, why are we doing anything about it? Because it's natural does not mean we have to suffer.
Hmm.
When you start to have vision, when you start to lose your vision, do you not get glasses?
Hmm.
Would you say because it's natural, okay, and then I'm gonna go blind? No, no. This is where we have to replace though, because your body still needs them to protect you, to do the other things. Especially people that have hormonal issues like endometriosis, the PCOS, they have such hormonal imbalance that we need. So when they get into perimenopause, now it's even worse because the little hormones that was helping them before, now they no longer have it. And that's why you have some people start to have intense menstrual period at the age of 44. They never had menstrual period pain before. They never had every period. And then at 44, then it starts because of the
Hmm.
hormones. Had these hormones that was helping them before. So when we talk about hormone therapy and we talk about the hormonal imbalance, at some age, it's inevitable, right? At some age, it's a natural transition. Now you go into menopause when you're no longer menstruating. When you're no longer menstruating, your body is no longer making estrogen, it's no longer making progesterone, but you still need them. And if you don't do anything about these hormones, what do? They increase your risk of a heart attack, and that is the number one killer of women. Okay,
Hmm.
your risk for falls and fracture. When you break a bone, you already know recovering from that at that age, at any age actually, except you're really young. When you have a fracture takes a toll on the body. Now imagine someone who's older, like 55 or 60, and you break a bone at that age. It's tough. Okay, not doing that affects our mood. Not doing that increases your blood sugar. Now you have a risk of being a diabetic. You have a risk of having high blood pressure. So these hormones do a lot more for us to keep us healthy than a lot of people give them credit for. So it depends. So when we talk about hormonal imbalance, it depends on what age, what conditions, what symptoms you're presenting with, and your prior medical history.
Wow. Wow.
I know that's a lot.
It is a lot and very, very vital and important. And I feel that actually these few minutes cannot do justice to just talking about hormones and hormone therapy and all that. Honestly,
Yes.
because honestly, I after I had my second baby, and all the surgery and loss of blood and everything that came with that complication and all that, you know, I have just been having. I just told my husband, I said something is not right. Something is not right. My mood will. Sometimes I'll just sit down and be crying for no reason.
Yes.
Sometimes it's just I'll be yelling. Something is just not right. And then I went to my Gani and I said, I know that, I had a partial hysterectomy, and all that. And they checked me and said, no, no, your ovaries are still there, so you're good, and everything. And I'm like, okay, yeah, maybe it's just my body trying to go through the healing process. I just knew that something wasn't right. Something wasn't just right. And I have older um big aunties around me that they are in their 50s, and plus, you know, and I know what they deal with.
Yeah.
When it comes to hot flash or their nails or this or that and everything. Okay, so I guess my next question to that will be,
Mhm.
because a lot of us will now have this, oh, let me go get vitamins, let me, supplement and all that.
Mhm.
Does that work in place of this hormone therapy, or is a add-on? You just have to have this hormonal therapy in place
Yeah.
while the supplement does the thing. Are they two different things, or how do that work? How
Yeah.
does that work rather?
So supplements is always an adjunct. Okay, it's always an add-on because when you think about a hormone is a chemical messenger, and I want people to let's use the menstrual cycle for instance, right? Estrogen and progesterone are responsible for the thinning of the lining of your uterus that will cause you to bleed. They tell the organs what to do. Okay, when the progesterone is getting ready, at some point in your cycle, your progesterone rises up because it's open for pregnancy, right? And then when there's no pregnancy, it drops down. That tells the organ, okay, you know what? There's no pregnancy. You can shed the lining of the uterus. Then you bleed. Okay. Then it does it again. Estrogen rises up, open that. Okay, we can have a baby. We can get the lining ready for implantation. Then progesterone takes over, and then it. So now tell me which supplement can do that? Which supplements can tell your organs what to do? There's no supplement because these are hormones. They're chemical messengers. They tell your organs what to do. That's why you cannot out supplement hormone therapy. There's some supplements that we need, like magnesium. We need magnesium for all of the processes in our body. We need magnesium for metabolism. We need it to feel well. We need it to make hormones. We don't get it enough from food. Magnesium, everyone needs to supplement. Vitamin D, as Black people, we don't get enough vitamin D because of the melanin. So it doesn't convert well. So we need that. So they have their own roles, right? Because vitamin D helps to make hormones, helps with the immune system, helps with brain fog, clarity, all of that. So they have their own roles, but none of them can ever take the place of hormone therapy. Because what happens is that you have people that would buy all these other supplements like black cohosh or ashwagandha or all these other supplements because they want to use it. Those can help with some of the hot flashes because what they're doing is they're masking it. They're suppressing the hot flash. But do you have estrogen? No. Do you have progesterone? No. Do you have testosterone? No. So you may not feel the symptoms, but the damage is still going on. And I would rather feel the symptoms so that I know that there's something going on than to suppress it, because all you're doing with some of those supplements is just suppressing the symptoms. You're not taking care of the root cause. So your body is still breaking down. And by the time they come in, they are so depleted. There's so much damage because they've sat on it for years. There's a therapy. As a matter of fact, you can take hormone therapy and not take supplements because they will tell your body what to do. Okay. Versus taking supplements and not taking hormone therapy because you're open, you don't want to take hormones. Okay. So we can't do it the other way around. The best way is collabo. You take the necessary supplements and you take your HRT. In addition to managing your weight, sleeping better, lifestyle, eating healthy, all of it. That's the best way. People ask me all the time, how do you do it? You talk on Instagram, you have kids, you're a mom, you're a business owner. Because my hormones are balanced. Look, I use all the resources available. I'm on HRT, I take my supplements, I drink my water, I mind my business, I don't overextend myself. And that's why. Well, that's what I tell people.
We're about to be following you right now. Everybody on this live, you better go follow her.
I'm like, that's why I have 5 boys. I have 2 practices. I'm a wife. I'm like, because I use.
And you still look beautiful. You still look young. You still look healthy. You still look fresh.
Thank you. Because I take advantage of all of this. So I'm not just telling you because I'm telling you because I'm one of you, because I'm a midlife woman, because I'm in my 40s too. And I know how it was when this perimenopause hit me. That's why I changed my practice to focus on women, because even I was a healthcare provider and even I still suffered. Okay, because we don't have enough knowledge about this. One myth that a lot of people say is, oh, but they said hormone therapy causes cancer. Those are it was a study that was flawed. There's been so many other research that has debunked this. And I know that a lot of us know people that have cancer that have never taken hormone therapy before. Therapy does not cause cancer. It can feed it if you have cancer because they help your body heal, they help you grow, right? So estrogen might feed it because it's a growth hormone, because like I said, it helps to grow the line of the uterus. So if you have cancer, it can feed it because it's a hormone that feeds the organs, right? That it's a growth hormone. But and then the hormones that we use right now are even much more safer, right? So if you've taken birth control before, birth control pill is a hormone, a synthetic form, a higher dose. So don't come saying, oh, well, they said no. If you've ever taken birth control, that's a hormone therapy. If you've ever used Mirena IUD, it has hormone therapy in it. So the education is just really different as to what people pick and choose. And it still has to do with the awareness, okay? The goal is for us to continue to give you the tools to allow you to heal and thrive and feel well at any age. That's the changing age.
The goal. That's the goal.
The goal is to help women age gracefully. Okay, so that we're not looking years older than our husband because we have all this stress that we're carrying on top of our head, on top of neglecting our health. We put ourselves at the back burner all the time. Enough. You cannot pour from an empty cup. Put yourself first. Be the best version of yourself, and everybody else will get the best version of you. But you have the best version of yourself for you first, in order to be able to give the best version of you out. If you're always depressed, if you're always in pain, if you're not sleeping, if you're always having mood swing, if intercourse hurts, if your skin is itching all the time, if you're having hair pain, if you're having vertigo, how will you feel well? How will you be the best version of yourself? And then you still have to be a mother, you still have to be a wife, you still have family drama that you have to deal with. How can you be well? How can you thrive? Your body will be stuck in this fight or flight mode trying to survive. We're not
Mm.
created here to survive, we're created here to thrive, and we can do that with the right resources.
Thank you so much. Honestly, like I said, these few minutes that we have is not enough to do justice. To be honest, honestly, I'm sure that we'll try to get on your schedule again and see what we can do to bring you back. Because to be honest, there's so many things just popping on my head right now. Alrighty, so for someone who is hearing you now, I have two questions here. But for
Yes.
someone who is hearing you right now, and this hormonal imbalance, hormonal therapy is new to them, where should they start from? Where should be the beginning?
I always encourage people to do your own research. Now we have Google, we have ChatGPT, we have Claude, we have, start with type in what is hormone therapy and start with your research. I offer a lot of education about hormone therapy on my page. I think more on my American page. And next month, I'm actually going to do a series on perimenopause, and it will be the whole month talking about perimenopause and hormone therapy to really break it down.
Okay.
But start with doing your own research. That's what I always tell people. And I know that there's so much information out there, and it can be confusing. But get yourself to understand what a hormone is, what hormone therapy is, what perimenopause is, what postmenopausal is, start with a basic education. If you have a doctor who is, very open-minded, you can ask your doctor, where should I start from? One of the posts that I will be linking on my page in the next few days would also have there's so many providers on social media, maybe not Nigerian, but, there's so many doctors and nurse practitioners are always talking about menopause and perimenopause. Those are good resources also to follow because they try to break it down and let us understand what's going on and how we can learn from it. I do a lot about that too. So those are things that you can do to empower yourself, because it really starts with your own understanding. So that way, then you can take your questions to your doctor, okay, and say, this is my understanding of what's going on with me. Okay, write down your symptoms, track it, keep track of the symptoms, and see what's changing. Okay, this is our body. We know our body best.
Yeah.
Okay, see what's changing. Some people, because of perimenopause, they start to develop body odor. Okay, they start to smell.
Mm.
This almost affect everything. They start to develop body odor, and then you're just like, what happened? What changed? And they think it's something else. I have patients in Nigeria, especially, who came to me thinking it's cancer. It's not.
Mm.
Much more than hot flashes or night sweats. Some women will never experience hot flashes or night sweats, but does it mean the damage is not going on? It doesn't. You're not just experiencing that symptoms. Well, we have over 100 symptoms that women can experience. And then when I start to tell, they're like, yeah, so yeah, my body, this, my knee, my back, everything hurts. It's painful all the time. And then I put them on hormone therapy, and they're like, oh my goodness, I didn't think that was what it was. Okay, because we don't have enough awareness about it. So do your own research. Women are brilliant. Okay, we can find whatever we want. Okay, use it for good. Do your own research. Follow me on Instagram, follow doctors that you see that you trust on Instagram, and learn before you even find yourself in it. Okay, if you're young, learn it now, so that way when it comes, you can recognize it. The
Yeah.
reason why there's so much discourse right now is because when it came, nobody could recognize it because we weren't really talking about it before. But
No.
about it before you need it, now it better prepares you. Now you already know who you're going to go to when you start to experience those symptoms. And I have to be acknowledged, it's not cheap. Okay, that's
Yeah.
a challenge. It's not cheap. Hormone therapy is not cheap. Finding a provider that will specialize in it is not cheap. It isn't. Okay, so you have to change your mind to say, this is an investment in my health. This is my investment in my body. Okay, see it as, if doctor says you need surgery, you're not going to question them. This is just as important because it protects you. Okay,
Yeah.
investment, and you have to be open-minded about it. So that's a full transparency. But do your own research, learn more about this, type it into Google, type it into chat. It will give you at least the baseline knowledge of what this is all about.
Alrighty. So someone is saying here that how do we go about hormonal replacement? Who do we see? So do they say, because usually we're always saying, see your doctors, and when it comes to women's reproductive issues, see gynecologists. So in terms of hormonal replacement, are they to see gynecologists, or do we have specialized doctors that specialize in hormonal treatments?
So you can see anybody as long as that person treats hormones, as long as that person understands perimenopause and menopause. So it can be your primary care doctor. It can
Okay.
and because they are OBGYN doesn't mean they want to manage
Yeah.
your,
Mhm.
know what I mean? So it's whoever it is that's going to help you. Okay.
Okay.
Me now, a lot of people that come to me already know that my niche is hormone therapy. So
Mhm.
so I see a lot of patients in Nigeria. We do telehealth. I prescribe the medications. The medications are already in Nigeria. We have it because we know they're hard to get because nobody's they think women don't need help. Okay.
Mhm. Mhm.
So if you have a doctor who you've been seeing, ask them, hey doctor, do you know about perimenopause? Do you before you start to waste your money? Okay.
Mhm.
Because
Mhm.
it might take you multiple trials before
Yeah, and that's why the knowledge is key. You need to do your research and
exactly
understand it first,
first, so that you know what to ask the doctor.
so that exactly.
So that way you can articulate what's going on. Okay. So that's it. If you find someone who specializes in hormone, even best, because if you really think about hormone therapy or endocrine issues, because hormone is an endocrine issue, right? You will
Mhm.
think the endocrinologist, but even a lot of endocrinologists don't want to deal with hormone therapy because they will just tell you, oh, it will go. So it's really not about the title, as long as it's a medical provider who understands hormones, because every medical provider can prescribe hormone therapy. We can prescribe and manage you effectively. It's just best if you go to someone who specializes in it because they
Specialize.
understand it from head to toe. They know it's beyond the labs. They know it's not, you know what I mean? Uh,
Yeah.
that's the difference. So it's really,
Yeah, one of the things that was very surprising to me when I started my own hormonal treatment was that even though I go for my annuals regularly, my Gani annual, my primary annual, when I started this hormone therapy treatment, the doctor had to request for a full set. And in my mind, I'm like, I just did labs. I just did some labs just recently, not too long. Why can't you use that? And when I sent her, she said, okay, send it to me, but I'm really sure that the
it's,
labs that I'm going to request is not part of what you've done. So I sent her a copy, and lo and behold, it wasn't, none of it was there. So
exactly.
she had to run her own test, and I'm like, so what's the essence of the annual that we're doing when you're not doing the full body and seeing what I'm lacking,
Yeah.
you know?
It's different because the things that we look at when we focus on hormone therapy and women's health, especially a lot of us that are more into the functional and holistic medicine, we look at things differently, right? We're not just looking at the basic labs. I know because we know that it's not fragmented; they're all connected. So
Yeah.
we need to make sure that you're optimized. It's not just normal because the reference range is really wide. So we need to make sure that no, it's not just about you being normal. We're looking at are you optimized? Can
Mm,
things a little bit. So that's why the labs that we ask for is very expensive. And I remember when I first started seeing Nigerian patients, I wanted to use the same lab panel that I use here in the United States for my patients, but it was so expensive. When they come back, the labs alone was costing about 1.5 million. I said, why? Right? So we had to modify and cut it down and see, even though we need those, but we have to work with what we have. Okay.
mm,
And that's just the best that we can do. In some situation, we just got to modify it. Uh,
yeah.
and then later I say, okay, you know what, maybe another time we can do this part and, do this part. But it's so expensive. And that's why I said it's not easy. Women's health, a lot of our treatments and procedures are so expensive
Expensive.
because they
Yeah.
are ones. They're not the general thing. Women's health don't fit neatly into a bucket, right? We have
Mm,
to investigate. We're looking at different things. And that's why, insurance, just want basic labs because it can be expensive. So I hope
mm,
that we get to a point where, a lot of these things are subsidized by the government and we have grants that can help so that way it can, because once you're on hormone therapy, it's almost a lifelong thing. It's not
mm,
like taking thyroid medication. You're almost on it for life. So we need to make sure that people can afford.
yeah. Yeah.
So yeah.
Thank you so much. One last question here. Yeah, okay. Someone is asking about how they can go about intermittent fasting. You mentioned intermittent fasting earlier on, how they can go about it. So
Intermittent fasting is just when you don't eat for a few hours, and there are different. time zones. It depends on what you need. The minimum, some people will say is 14, but I always say the minimum is 16. It really takes 16 hours of not eating anything at all before your body starts to get into that before your body completely empties digestion, especially for those of us that have a high carb diet. If you're just eating salad or whatever, then it might not take that long, but I always say at least 16 hours. So that means that at nighttime you stop eating at like 6 o'clock, or maybe let even say 7 p.m. at night, and 7 a.m. in the morning. That makes it about 12 hours already, and then you wait till about 10, right? That makes it 15. So that means you don't eat from like 7 to like until like 11 or 12. So that's what intermittent fasting is. And you can drink water, but you cannot eat at all. No milk, no sugar, nothing. Because what we're trying to do is we're not trying to trigger insulin, body to release insulin. When you eat, your body will release insulin because it needs to break down the food. So we're trying to not release insulin at all, so that your body stays in that low state of insulin, and it reduces inflammation. It allows the body and the tissues to heal. And the longer you go into that intermittent fasting, the more beneficial it gets. Okay. The more, some people do 24-hour fast, some people do 22 hours. So it just depends on how many hours. So it can go from 16, you can do 18, 20, 22, 24. So intermittent fasting just means that you have these extensive long hours of not eating anything at all. And that allows your body to really digest food, break down, and heal itself. So that's what intermittent fasting is. So you can pick the one that works well for you. But it also depends on your underlying condition. If you're diabetic, you might not be able to do it, right? So it depends. So talk to somebody, either a nutritionist, or if you have no underlying medical condition, then you can start on your own, and start slow. Maybe start with 14 hours, see how you feel. And then, because I know some people, if they don't eat breakfast, it's trouble for them. So if you're one of those, you might just change it to during the day and just eat in the morning, and then start intermittent fasting in the afternoon. So you can modify it. Excuse me. You can modify it however way works for you. It's just easy at nighttime, just because you're going to sleep anyway. So you sleep, you wake up, you're already a few hours in. So that's what intermittent.
Alrighty. So finally, before we let you go, what would be your message to women generally, whether dealing with pain, endometriosis pain, dealing with hormonal imbalance, or women generally? It's March is also Women International Month. So what would be your message about taking care of our health holistically?
Yeah. So my message to women would be to choose yourself. Okay. A lot of women think that they are irreplaceable. They think that, oh, nothing can get done if I don't do it, and that's not true. That's not true. Choose yourself, and if you choose yourself, excuse me, you will care for yourself well. Okay. Don't continue to put yourself as a back burner. Your children are your children. They have their own life. Your husband has his own life. Your family members have their own life. You have yours. Your responsibility is to keep you healthy to the best of your ability. Okay. So ask for help and take the help. Don't be like the Okogan of the house. You're the one doing everything. Nobody can do something the way, because you want it done a certain way. Doing things a certain way and not utilizing help breaks you down even more. Okay.
Mm,
Ask
mm.
for help, take the help, manage your stress, and put yourself as a number one priority. That's my message.
Thank you so much. We truly appreciate you. Thank you so much for helping us to break things down. Like I said, we'll definitely I'll find a way to get on your calendar one more time, because we really need to talk about this. Honestly, especially with this hormonal imbalance is a thing. It's really a thing, and we as women we need to start paying attention to that aspect of our being, our lives, so that we can be a better person, a better individual, like she said, you know be mindful of yourself. I know that as women we have this caring, spirit and everything, but care for yourself, care for your body, your health. Health is wealth, as we say here at LifeBloom. Thank you so much. And to our audience, thank you all so much for joining us today. I hope that you have really learned one or two things that you can hold on to. And please go on our page. Mosu, please pin our page somewhere so that people can follow her. Please go on our page. Please, before I let you go, can you just say the page, so that the name of your page again, so that your handle, so that people can go look for you. Please follow her. She puts out a lot of resources, information, educative resources. You will learn. I can guarantee you that you will. When if you get on our page, I can guarantee you. I have something that I've learned. I'm going to discuss with her very soon.
Okay.
I guarantee you will learn when you follow her.
So my page is Serenara Wellness. So Serenara Wellness.
Okay.
This is where I really provide a lot of education, and it's not just about science. It's really about all things like social, all of the social norms that affect women, because women's health is much more than just medicine. We have to talk about the factors that influence how we live and heal. So Serenara Wellness is the page to follow, especially if you're in Nigeria, and I will, like I said, I will be starting a series next month in April, talking about all things perimenopause. It's going to be dedicated to perimenopause, and I also have a series on my page where I talked about fibroid. It was a month dedicated to fibroid. There was one dedicated to period health. So you can go there and learn all about period and menstrual cycle and the things that you can do. And this is my way of giving back. This is. Because I already know that for us in Nigeria, we don't have a lot of these resources, and I think that your blessing is for you and those around you,
Yeah.
and of giving back from thousands of miles away is to show up and provide this education so that way I can open your mind to at least know that there's something here, and you don't think you're making it up. That's my goal. My goal is to light up that bulb to say, oh, I thought this was normal. And because something is common does not mean it's normal. Okay.
Yeah. It
We
is.
can help.
All righty. Thank you, thank you, thank you so much. Thank you everyone for joining us. And we will see you again tomorrow. We have another guest coming on tomorrow. We'll see you again tomorrow. We want to talk about how food can help us really, really with whatever we've talked about today, our pain, hormone balance, and all that. We want to see our food because we believe that food is also medicine, and we want to see how that can help us. Thank you all so much. We truly appreciate it and look forward to seeing you all again tomorrow. All righty. Bye.